interested to follow up on a review that the World Health Organization did in 2007. And they got experts together because there was concern about the effects of night work on breast cancer risk. And this expert group concluded that indeed shift work involving disruption to your natural body clock probably was a carcinogen. But they based their results mainly on animal evidence, and there was quite limited human evidence. So following that review, there was increased concern and a call for new studies, particularly from the UK Health and Safety Executive. So we have built on 3 existing studies, 2 from Oxford, and these are the Million Women study, EPIC Oxford, and also a big UK study called UK Biobank. And what we did was to ask people already in these studies questions about shift work, whether they'd ever done shift work and how long for, and then we followed them since then to see who's developed cancer, in particular breast cancer. 14% of women have ever worked night shifts, and of particular interest to us, about 1 in 50 women have worked long-term night shifts, so have worked nights for at least 20 years. So we've found both in our 3 new studies and in our review of all of the relevant evidence of breast cancer incidence in women, we find no link between night shift work and breast cancer risk. And also we saw no link when we looked at night shift work and long-term night shift work and breast cancer risk, and that's really where most of the concern was. And we do see substantial differences in the characteristics of women who have and haven't worked at night. So for example, we see that women who've worked at night are more likely to be obese, they're more likely to have smoked, they're less likely to have had children, and we know that things like obesity and reproductive factors affect your risk for breast cancer. So we've had to take care to look at those things in our statistical analyses. But actually, when we run the analyses, we see both with and without taking careful adjustment for these factors, no association with breast cancer risk.